Today we'll be chatting with Anthony Lombardi, who will be teaching a specialty class during our Acupuncture and Asian Medicine conference this year. Anthony, thank you for talking with us today.
Thank you. Thank you for having me. I'm very excited about this conference.
This year, during the Fsoma Acupuncture and Asian Medicine conference, you're going to be teaching EXSTORE, an introduction to the system that simplifies musculoskeletal assessment and treatment. Can you tell us what inspired you to create this class?
Most definitely. This inspiration, believe it or not, came about 13 to 14 years ago. It was around in 2009. And so at this time, I was about 7 years out of school. Started my own practice right out of school, so about 7 years in private practice, and it was going well. But what I started to notice was my treatments would not be based on anything in specific. So, for instance, in school we learn orthopedic tests. We learn certain orthopedic tests for knee pain, for low back pain, things of that nature. So each patient would come in, I would do these orthopedic tests, and then I would formulate my treatment. I would use acupuncture, soft tissue work. But as time passed, I found that I was doing the treatment based on not what my results of my assessment were, but based on how similar patients in the past presented. So for example, let's say a patient came in with neck pain between the shoulder blades. I found that my treatments would be based on more so, I remember a couple of weeks ago, a patient came in with a similar presentation and I did an inline technique, or I did this. So I would do that. And a lot of the times, my results were pretty good. But what happened was I started realizing is it was more of a cookbook approach. And the cookbook approach only is successful 60, maybe 70% of the time. And the funny thing was I found that talking to some of my colleagues, this was something that was done. They're like, oh yeah, that's how I treat them. That's how we treat them. And that's how the majority of the world does it. And I thought, how do I get better results? Better than 60%, better than 70%. And I thought we have to have a system. So I started doing muscle testing and I started focusing on a simplified way of doing it. And what I came up with is muscle testing, muscles that are attached to the spine, but also attached to the muscle girdle. And there's two girdles in the body. There's a scapular girdle, and then there's a pelvic girdle. So from this, we narrowed it down to 8 or 9 tests, and we did some range of motion. And from this, I started to apply this system. And what I started to see was when I applied the system, essentially in mechanical problems, patients that have mechanical base injuries, shoulder pain, low back pain from an injury or something like that, I found that what I did was when I found the muscles that were weak or the range of motion that was below average or below grade, I focused on those things that were not functioning correctly. And when I did, we got really consistent, really outstanding clinical results. So from this, the EXSTORE system was born. It's a system which allows you to treat muscle and joint-related pain, find out what isn't working so you can start correcting it within less than a couple of minutes. In fact, oftentimes less than a minute, because now with EXSTORE, a lot of it's history-based. So based on the patient intake form, looking at the file, making sure you ask certain questions, you know within a couple of minutes what's going on, whether the problem's a mechanical problem or not, and then you get down to the assessment. So systemizing the approach was a big goal of mine, and it turned out that it really changed my practice, and my patient referrals, as we'll talk about later, just skyrocketed, and I've been doing it ever since.
Wow, that is an incredible story. So I think with that, you answered a little bit what was the clinical application for this class that you're going to be teaching. but could you talk a little bit more in detail about the clinical application?
For sure, for sure. So the beauty of this is that this system is not just for muscle and joint related pain. It is for pain, but of course we know that pain doesn't always originate from a muscle or a disc or a joint. It can come from other things. It can come from things like diabetes or fibromyalgia or inflammatory arthritis that can present physically. And so what the EXSTORE system does, and what I'm going to be showing in Fort Lauderdale, is an introduction to allow people to step back and open their eyes and their clinical mind to see that pain is not, all pain is not the same. They originate from a mechanical genesis and also chronic systemic. And the key is, once we find which one it is, a mechanical or chronic systemic, then the path becomes so much easier. The view is clear on what we have to do. So from a clinical standpoint, once we know if it's a mechanical problem or a systemic problem, a problem with the organs, or a problem like that is everywhere, like diabetes is in all tissues, inflammatory arthritis is in all tissues, versus if someone hurts their shoulder, it's just in the shoulder. Once we know that, and this is what I demonstrate, this is what I'm going to present to allow everyone here to see how clear it is, and so then they can really see how the EXSTORE system works. So it's such a tool in my practice that it's my clinical results, as I said, since 2011, I averaged 12 new patients a week. And this is consistent over the last 12 years. And it's just because results equal referrals. And since I systemized the way I assess, this is what's happened. And so I'm happy to bring that to my class in August in Fort Lauderdale.
Amazing. So you went over some of the benefits, right? Like increasing patient referrals. What would be other additional benefits of learning this technique and taking your class?
Well, definitely. So getting referrals is great. You can, what it does, because it really allows you to save time. So instead of an assessment taking 30 minutes, this assessment is cut down to, once you become proficient at it, 8 minutes. This is history, going over the paperwork, going over the physical exam, 7-8 minutes. So how I thought in my practice was, if I put 45 minutes aside for a new patient, I found that when I applied EXSTORE, within 7 or 8 minutes, or even less, I was already having the patient on the table and I was inserting needles. So the benefit here is that the patient gets better faster, and the reason is we're able to spend more time on treatment. And if we spend more time on treatment, especially early on, especially in the first visit, the second visit, the patient sees such a dramatic improvement in their symptoms, in their strength, in their range of motion, that they're excited about coming to their second and third and fourth visit. So the benefit would be, one, you save time, which means you spend more time on treatment. And two, the patient does get better faster, which means if they're getting better faster, they are referring more patients. And I always ask patients for referrals and tell everyone, take some cards, and they're happy to do so. And in the social media age, they're happy to do a Google review, or happy to tweet it or share it on social media. So the big time is being time efficient. That's what they are really going to learn from this, and being able to apply instantly. So it's a game changer, especially in what acupuncture doesn't treat muscle and joint related pain. It's the number one thing that we treat, and that's treated in North America. So it's I'm excited for those who are going to be present, because they're going to see a different side of how to treat muscle and joint related pain.
Very cool. Thank you. And could you share with us a bit of your professional history?
Definitely. So I'm actually a chiropractor by trade, but I come in peace. And what I did was I started learning acupuncture right out of school. There's a program in my hometown here in Hamilton, Ontario, McMaster Neurofunctional Acupuncture Program. And because when you start a practice, I started a practice right out of school. Like any business, you don't have a lot of patients, like physical patients, right? You start at zero. So I would have maybe 1 or 2 patients a day. Some days you don't have any patients. So I was able to fill the time with with taking courses. And I took the program. And after I took the program, so that was 2003, 2004, they asked me to come on as an assistant instructor. And what's great about the assistant instructor is, back in the day, to be an assistant instructor, it didn't really pay much. But you don't do it for the money. You did it because I got to keep learning and learning and learning and learning. And so I did that from 2004 to 2013, 3 or 4 times a year. I was an assistant instructor. And that was very fruitful because when you learn from people that are better than you, and not just acupuncture, not just clinically, but in sports and anything, when you learn from people that are better than you, you get better. You can't help but get better. And so I kept teaching because I was like learning so much. And twice I was selected, and this was kind of a personal highlight of mine. We were selected, that program, the McMaster program, the United States, remember, this is in Canada, but the United States Navy came to the program and said, listen, send us a group of practitioners to come down to San Diego to teach the U.S. Navy doctors acupuncture. The acupuncture to treat muscle and joint related pain. So that was 2009 and 2010. And I was fortunate enough to be selected as one of the 7 practitioners. So I got to go to San Diego, California for a week and teach on the naval bases to be part of that team. And so 2013 rolls around, but 2011 is when I put together EXSTORE. I put together EXSTORE. It was an online component. Actually, it was through the mail. You would get the manual and a DVD through the mail. And then I started teaching live classes. And this took us to approximately 2018 when I met Joshua Swart, and he introduced me to the United States and the acupuncturists, TCM practitioners. And this was kind of a whole new ballgame for them because they were able to learn MSK assessment, anatomy in a simplified way that helped them get outstanding clinical results. And that's where it takes us till now, 2018 till now, and in between there was a pandemic. But in that time, I was able to produce a lot of webinars. In 2 years, I went online and produced over 50 webinars because a lot of students were still interested in learning, and obviously we couldn't do it in person. And so we do it online. And so, that takes me here. I've been in practice 21 years now.
Congratulations. That's amazing.
Thank you.
What would you say is the success rate of using your technique in the clinic? I know you talked about this a little bit earlier on, but if you can talk a little bit more into detail about the success rate.
Yeah. So, I saw that question and I thought about it. And the success rate is, so there's many things that go into what anyone would qualify as success. If you ask me, I'm going to tell you 100%. And it's 100%. Now, 100%, does that mean that 100% of the patients that come in walk away healed? No. And the reason is because a lot of times, the reason they're there, what you have to offer, acupuncture, soft tissue work, is not the solution. And let me give you an example. Someone comes in, they're having, let's say, shoulder pain. They're having shoulder pain or back pain, and you go through the history, and you start to realize some of their signs are not consistent with muscle and joint related problems. So you start asking other questions. For example, you have a history of inflammatory arthritis, and when it doesn't look like a mechanical problem and we don't know what it is, we don't know what to treat, right? Then we're guessing. So the system allows us to never guess. So in a case where the patient comes in and I don't think it's muscle or joint related, I need to get more information. I refer them out for blood work. That's one thing we learn in the EXSTORE system, when to make the referral out, when to refer out for more information. So here in Canada, I'm not able in my scope of practice to refer out to blood work. So we refer out to their family physician as an example. So, but it's the system that allows me to recognize the difference. Now, assuming we're dealing with a muscle mechanical problem, we find what isn't working, we correct it, we do the soft tissue, you will get improvement. There's no reason why the person should not improve unless there's a third party reason. So here's another reason. Patient was in an auto accident. Patient had a slip and fall at work. So it might not be in their best interest to get better right away because they have an attorney saying, well, we have to, if you want to get a good settlement, these things have to happen. But all things considered equal, if you apply the system, if you think clinically, the results you won't be able to miss. And whether that means referring out or just applying the treatment, it's a very high success rate is what I'm getting at. And I think the proof is in the, people say the proof is in the pudding. I think the big thing is, what's the referral rate? And I mentioned I average 12 new patients a week. And just to put that in perspective, the average practitioner in North America averages 4.2 new patients per week. And I'm averaging 12, and I've done so since 2011. So I don't think that's just me. People say, well, maybe it's not just me. I think it's the system. So I think it's the approach. And so that's why, I say 100%, is if you're using it 100% of the time and using it correctly, it's going to work for you, whether you refer the patient out or whether you heal them.
Awesome. And could you share with us a case where you had the best success with a patient?
Yes, there's many. Let me think of definitely. So there's one. There's a hockey player. So here, where I am in Hamilton, there are a lot of professional hockey players that are from here in the National Hockey League that come back here in the summer just to train, or in the off season. There's a lot of arenas around here. So I do get a lot of patients, and this is the best because it's kind of like it's the most entertaining and it sends the message, so to speak. So the patient comes in and they have a left shoulder problem, okay, and they're in the NHL, and they come in for treatment. I go through the EXSTORE scan, and the EXSTORE scan, there's an upper extremity and a lower extremity. I do the upper extremity, and I find a couple of muscles that are inhibited, say the serratus anterior, the deltoid. I use the electroacupuncture. That's the other thing. I use electricity a lot of the times when I'm stimulating these muscles, because that activates the muscle. The muscles are shut off, and we, they improve through the activation. So right away, he sees great improvement. Okay, and a couple of visits pass, and he's doing great. And on the third visit, every time I enter the room, hey, how are you? I shake their hand, nice to see you, and I shake the patient's hand. And one thing that I've developed over the years, and I think a lot of practitioners can probably attest to this, is that when you shake someone's hand or when you watch them walk, you can tell when something is off or not working. So I shake his hand, and I feel something isn't right. It doesn't feel, there's a certain feel of a handshake. And because I'm running from room to room, because I see multiple patients at the same time, and I have many rooms, multiple rooms I work on. I didn't get a chance to look at the file. I know I'm treating his shoulder, but because I shake his hand and I feel that something's off, I say to him, I say, "Oh, what happened to your shoulder? Did you re-injure?" And he said, "No, it's my left shoulder we're doing. My left shoulder's doing great." And I say, "Well, but what's wrong with your right shoulder?" He goes, "Nothing." I said, "No, something's wrong with your right shoulder. That didn't feel right how you shook my hand. We shake your hand again." I shook. I go, "No." I said, "Something's off." So I go through the EXSTORE scan again on the right side, and we find out that he has no stability. The muscle, the serratus anterior that stabilizes the scapula, has zero stability. And he's just like, "Oh my God." It's just like, he was like, almost like, "How did you know that?" I said, "Well, I told you, it just didn't feel right to me." So I go and I do this. What I did on the left side, I did on the right side. And I stimulate it and then we retest. And the following visit, he comes in and he's doing great. And he thought that, that really blew him away because of, like, it wasn't like, usually patients come in and they tell us what's bothering them. And an interesting thing with the system, one exercise we do in the big course, is we have the patient come in, but I don't have the patient tell us why we're there. It's the practitioner's job to find what isn't working so that it's corrected. So that's the key. So the EXSTORE system, they can end up, they can tell the patient what's going on. And that's the beauty of it. It doesn't just work traditionally. It works untraditionally where we don't necessarily have to know what's wrong to find out what's wrong. So I think that's the most memorable story. That's usually the one I tell because it's kind of, it's interesting.
It is. It's very cool. Well, thank you so much for sharing your time with us today. Just a reminder for everyone, this class is a 3CU class under the category of biomedical, and it is going to be all day, Friday, August 25th, from starting at 9 a.m., which is part 1, and then at 2 p.m., we'll do part 2. This is also a hybrid class, meaning you can attend live in person in Fort Lauderdale Beach. But if you can't make it live, then you can sign up for this class virtually and enjoy it from the comfort of your home. Although I will say, because of everything that Anthony has shared with us today, I highly encourage you all to attend in person. It's going to be a completely different experience, but either way, you also have the virtual option. Again, Anthony, thank you so much. It has been a pleasure getting to chat with you today, and I'm excited to meet you in person in August.
Thank you so much, Natalia. I'm really happy for this opportunity, and I'm also excited to meet everybody at the seminar.
We will see you all there. Thank you.